shark or not?
So for your external stuff,
okay.
going down the list, anteriors towards the what?
Front.
Towards the front. So if I'm looking at this shark right here on your test tomorrow, if I say, if I'm right here and I move this direction, which direction am I moving? That would be anterior. If I move this direction towards the tail, which way would I be moving? Posterior. Okay, if I'm on this side of the shark, this is dorsal or on the back. If I'm on this side of the shark, this is the ventral side of the shark. Okay, rostral. If I'm on the head right here, I'm already on the head. I can't move towards the head if I'm on the head. If I'm here on the head and I want to move towards the tip here, that's called rostral because this is the rostrum, right? Okay. Proximal and distal. If I'm here on the fin and I move out, I'm moving distally. If I'm here and I move towards the body, I'm moving proximally. Okay? And then lateral and medial. If I have the fin here and I move the fin towards the midline, it's medial. If I move it away from the midline, it's lateral. Okay? The name kind of tells you posterior dorsal fin. Okay? Here's two fins, dorsal side, right? There's two fins up here. Posterior, anterior. The anterior dorsal fin is the iconic fin you see stick up out of the water when the shark's chasing you. Caudal fin. Caudal means tail, so this is the tail fin back here. Okay. And then on the bottom side down here, you have pelvic and pectoral fins. Your pectoral muscles in your body are where? They're in your chest. That's your boob muscles, okay? That's the one that, you know, The Rock can do the peck pops of love with or whatever, right? All right, so these are the pectoral fins here. These are the pelvic fins down here by the pelvis, by what you would associate with your legs where your pelvis is. All right. We did rostrum. External nares, okay? The external nares are what you would think of as the nose holes or the nasal flap. This is actually called the nasal flap right there. Those are the external nares on either side. Openings of the ampullae of Lorenzini, if you flip them over and you squeeze a little bit, you can see the little openings and holes here, little tiny pores. Those are the openings of the ampullae of Lorenzini. Of course, mouth. That should be pretty easy to find. Keel. If you look in the tail, in the caudal fin back here, you can see as the body extends into the fin still, where you have a dorsal and ventral lobe of the caudal fin. Then that splits it in half. That's called the keel as the tail extends into the fin. Spiracle. The spiracle is this hole right here on the top of the head. Right here, this is the spiracle. And then the urogenital papillae and the urinary papillae in the female. The urinary papillae is here. Okay, it's that little flap in there. In the male, it's in the same spot. Okay, but it's a little bit different. They have these little finger-like projections. These the urogenital papillae in the male, and these are the claspers. You can see the difference in the female. The female doesn't have those. If you feel these, they're rigid. They have a spine. That spine's what the sperm travels down to enter the female. Okay, but these are the claspers on a male. And inside the male, you can see how they have these little finger-like projections. That's the urogenital papillae. Inside the female, however, it's that one large projection right there. Okay, that's why it's a urinary papillae. Does that make see the difference? Okay. Of course, the eye is here, and external gill slits. Those are them right there. That's where water travels out. It'll travel in the mouth and in through the spiracle, and then pressure builds up and comes out the spiracle, and the water will be pushed across those gills and flow out here. That's how it exchanges oxygen in the water. All right, and then the lateral line system. If you'll look on the shark, you can see it ties in with the openings of the ampullae of Lorenzini. This lateral line system runs down the side of the shark. You can see that line that divides it basically in dorsal and ventral halves. All right, musculoskeletal system. Epaxial and hypaxial muscles. If you're looking at the shark, okay, and here's that lateral line system right here, and you can see it divide that shark into two halves. Epaxial muscles are here, hypaxial muscles are there. Does everybody understand that? Epaxial muscles are here up top, hypaxial muscles are below. All right. The septums, the mid-dorsal septum, you can see here that line that runs, it looks like it runs right down the center of the back, right? And it divides the shark into left and right halves. That's the mid-dorsal septum. Mid tells you middle, dorsal tells you back, okay? Septum tells you separate. Horizontal septum, you can look here on the side, and it pretty much follows along that lateral line system. You can see right here is it'll divide the shark into dorsal and ventral halves in the muscle groups, okay? Linea alba. Cut this one off. Y'all still have one. Yeah. I bet we cut it off.
Skin.
Okay, now, see right here how these muscles come this way and these muscles come this way, and there's a line right here in the middle? That's the linea alba. Think about like this in your stomach, you know, if you, well, I have one giant ab, but some of you may have abs one day if you don't already have them, and you can see the little bumps right there, but you see the line right down the center of your stomach that divides you into left and right halves? It's the same thing here. That's what's considered the linea alba, okay? All right, myosepta and myomere is real easy. Myosepta, septa means to do what? Separate. So if I'm looking at the muscles, right, and you can see these little white striations right here, that separates that like tan colored muscle from that tan colored muscle. So when you're talking about just muscles and septums, the myosepta, myo means muscle, so myosepta is those little, not ligaments, what am I trying to say? It'll come to me in a minute. Anyway, it's a little small septum. The word is evading me and it's pissing me off. You ever do that? It's like it's right there, you know what you want to say, and you just can't pull the word up. Mm-hmm. It's going to come to me in a minute. Anyway, it's like a ligament, but it separates the different muscle groups. The myomere is the actual muscle tissue itself, okay? All right, adductor mandibular, biggest muscle right here. Big circular muscle on the side of the jaw provides a bite force for the shark. Cucularis is this muscle that runs right across the top. Here's the adductor mandibular, and the cucularis runs right across the top right there. So you can see part of it right here, okay? It's like a triangular shaped muscle. Interhyoideus, intermandibularis, and coracoarcurals. So if I'm looking on the bottom of the shark, oh, y'all cut those out. All right, if I'm looking on the bottom of the shark right here, you can see you have smaller striations up here. This is the intermandibularis. This is the mandible, right? Right there's the mandible. So inter means between. So these muscles right here, intermandibularis. No, I'm sorry, interhyoideus, intermandibularis is these big muscles right here in the middle. I got them in order. Interhyoideus, intermandibularis, and this circular muscle right here is a common coracoarcurals. Okay? Meckel's cartilage is that piece of cartilage right there. The bottom jawbone of the shark, that's Meckel's cartilage. That's a mandible, yes. But that's called Meckel's cartilage, okay? Pectoral fin extensor, pectoral fin flexor. So if I look at the fin, this one's better. If I look at the fin here, like this, see how the muscles are pulling this way? On the bottom, this is the pectoral fin flexor. It's going to flex the fin in, okay? If I look here on the top, when these muscles contract, they're going to extend the fin out. These are the pectoral extensors, pectoral flexors. All right, dorsal and ventral constrictors. If you look on, let's see if yours looks like a little better. If you look on the top side of the shark right here, this is the dorsal constrictors. On the bottom side of the external gill slit, these are the ventral constrictors, and they're what open and close those gill slits. Okay. All right, vertebra and notochord. So if I'm looking in the shark's tail right here, they got the tail cut. This whole thing, this whole piece right here is the vertebra. That big disc in the middle right there, that's the notochord, okay? And while we're in here, the hole at the top, like if you're looking at like this is the top, that's the dorsal side, that's the ventral side, okay? So you see a hole right here, that's where the spinal cord is. Then you have the notochord, that gives rigidity to the vertebra. Then you have two holes, one top, one bottom. This is the caudal artery on top, caudal vein on bottom, okay? And we'll get to that when we get to the arteries and vein stuff. All right, pleuroperitoneal cavity, inside the shark. Mesogaster, if I find the stomach right here, if I find the stomach right there, that sheet-like structure that's holding the stomach to the dorsal wall is the mesogaster. Gastrosplenic ligament, it kind of tells you what it is. Where's the spleen? Right there, right? That's the spleen, the little arrowhead looking thing. Here's part of the stomach right here, right? And that little sheet-like structure that holds the spleen to the stomach, gastrosplenic ligament, okay? Mesocolon. Here's the colon right here, or what's going to be called the colon. This is actually the spiral intestine, but it's like our colon. So this sheet-like structure right here that's holding the spiral intestine to the dorsal cavity, mesocolon. Hepatoduodenal ligament. Hepato tells you what? What's hepatitis? Yes, liver, okay? Duodenal, duodenum. I'm looking for the duodenum. So here's the liver right here, and you see this group of blood vessels and veins and arteries that are coming out of the liver, and they're running right here towards the duodenum and the pancreas. That's the hepatoduodenal ligament that's holding those together, okay? Mesentery proper. Let me do it on this one. You got babies in the way. I'm sorry, I did that backwards. The mesocolon, where's my rectal gland? There. The rectal gland, see this little finger-like projection down here? Okay, that sheet-like structure holding it to the dorsal walls of mesocolon. The mesentery proper is what, well, you can see it better up here. Mesentery proper is what's holding the spiral intestine to the dorsal cavity, okay? All right, real easy. Stomach, that's the first part of the tube right here. You cut the stomach open, look inside, the folds inside the stomach are the rugae. All right, the duodenum, as the stomach comes around and makes this loop right here, that's the duodenum. Always in the hook of the duodenum, you're gonna find that sheet-like structure right there, that's the pancreas. Right here, that pancake-looking flat structure right there, okay? Valvular intestine is right here. If you open it up, you can see the spiral valves inside the valvular intestine, okay? The rectum is this part of the tube right here, okay? We did the pancreas. The liver is this three-lobed thing right here. You have three lobes of the liver, okay? And in the central lobe of the liver, you can see this little sac-like structure, like a deflated sac-like structure at the end. That's the gallbladder, okay? In the female ovaries, this is the female shark. So here are the ovaries up here, okay? And the mesovarium is that mesentery that holds the ovaries to the dorsal wall. Then you have the oviduct, which is this tube right here, okay, that goes from the ovaries down, and that tube is connected to the dorsal wall by the mesotubarium, okay? And then the uterus is this part right here, and in their uterus they have a couple of baby sharks in there, okay? The pyloric sphincter, all right? The pyloric region of the stomach is this region right here, and you can see as it pinches down right there, and then the duodenum starts to make the hook around here. That region between the stomach and the duodenum is sectioned off by the pyloric sphincter. It's a little circular muscle that closes off and allows food to pass and doesn't pass. All right, kidneys. If I look in the dorsal wall right here, you see the aorta right there, that pink tube, that's the dorsal aorta. On either side of that, you'll see a little puffiness that doesn't quite look like this. You can see how it puffs up on either side. That's the kidney on either side of that dorsal aorta, okay, running down that dorsal side. And then we did the rectal gland. That's that little finger-like projection right down here. All right, in the male, the testicles are in the same place as the ovaries in the female. Here's one testes, okay? And then, where's that? The mesorchium is the mesentery that holds the testicle to the dorsal wall. It's that sheet-like structure right there. The epididymis is the first part of the tube as it comes out of the testicles where the sperm travels down. You can see it come out right here and get little squiggly lines right there. Excuse me. The ductus deferens is when those squiggly lines get really far apart and kind of big, right? And then as it moves down into the seminal vesicle, see how it gets puffy right here? That's the seminal vesicle, and that dumps into the sperm sac, and you can see this shark sperm sac right there, right here, okay? All right, heart, pericardial cavity. The parietal pericardium, if I open up the heart here, you can see that it has like a really slick lining around the cavity. This is the pericardial cavity. Peri means around, cardia means heart. So the cavity around the heart, the pericardial cavity. You can feel a slick lining right there, okay? That's to provide lubrication for the heart as it's beating all the time. The parietal pericardium is that lining, okay? The ventral aorta, if you look at the heart right here as it comes up, you can see here's the ventricle of the heart. The conus arteriosus is that tube that goes anteriorly out of the heart towards the head. And then you can see where that tube just sort of turns milky white right down here at the bottom. Down here, that's the ventral aorta. Remember, the dorsal aorta is that pink artery that runs down the back. So basically, this is going to go up and hit the back and run straight down the back, and it's going to provide blood to the rest of the body of the shark, okay? The atria, you can see on either side of the heart, they're little sac-like structures on either side of the ventricle. There's one there, and there's one here on this side, right here, okay? And then the sinus venosus, remember sinus is nothing but a cavity, right? When you have sinus infections, you have many sinuses in your head. That's all it is cavities in your head. It's filled with mucus and pus and all kinds of stuff, and that's what causes snot and all that good stuff. All right, so a sinus venosus, you're looking for venous blood in a cavity. So if I pick the ventricle up, you can see this big sac structure, like structure under the ventricle right there. That's the sinus venosus, the cavity that all the sinus blood pushes into, all right? The transverse septum, you can see it here. We cut through it to see the heart, but there's part of it there, and there's part of it there. It would divide the pericardial cavity from the pleuroperitoneal cavity where all the rest of the stuff is, okay? Keeps the heart separate. Coronary arteries. Coronary tells you what?
Reminds me of cornea, but that's not it.
That's not it. If you have a coronary, that means that you're having a heart attack. All right. So if you look on the heart, you can see all these pink arteries. Those are the heart's a muscle too, and it's got to have oxygen to continue to work. So the coronary arteries are those arteries that are on the heart that feeds the heart. When you have a coronary heart attack, that means that one of those arteries at some point got blocked, and everything below that blockage dies off. That's what a heart attack is, when a part of your heart dies off and can't function correctly anymore. Okay. Dorsal aorta, we talked about that. That's that big pink artery running right down the center of the back. It comes from the ventral aorta, runs all the way down the shark right here. Okay. Jagger, you gotta move. The celiac artery is the next largest artery we're going to look at, and it's going to come off the dorsal aorta right here. It comes off the dorsal aorta way in there, and it's that artery right there, and it runs to the ventral side of the shark and provides blood flow to the ventral side of the shark. Okay, it's that big pink artery right there between. You'll find it usually between the stomach and the liver, and it runs through that hepatoduodenal ligament into here and branches off into the different arteries that feed the backside of the shark. Intersegmental arteries. If you look at the dorsal aorta right here, and you can see all these little arteries that branch off left and right into the muscle tissue around the shark. Those are the intersegmental arteries. Ovarian arteries, we're going to look at the ovaries. And we're going to see these arteries right here. There's one right there that runs into the ovary. Okay. Testicular arteries, the same thing. We're going to go find the testicle. And there's an artery right there running into the testicle. Those are the testicular arteries. Okay. Hepatic artery. Hepatic tells you liver, right? So this artery coming right here out of the liver, there's one of your hepatic arteries. Gastrohepatic artery. As that artery comes out of the liver and comes down here and branches off, that's the gastrohepatic artery right there. See how it's branching off the hepatic artery, running towards the stomach. Gastro tells you stomach. Then gastric artery, when I look on the stomach right here, you can see these arteries that are running to the stomach and are on the stomach. Those are gastric arteries. Pancreatico-mesenteric artery. Pancreatico-mesenteric artery. So pancreatico sounds like what? Pancreas. So I'm going to look right here. There's the bottom side of the pancreas right there. That pancreatico-mesenteric artery is right there as it runs into the bottom side of the pancreas and runs down through the mesentery. Okay. Duodenal artery. Well, let's find the duodenum. There's a duodenum right there. Let's see if I can get some of this out of the way. There's a duodenum right here. Okay, right there. So I'm going to look on the duodenum for that artery feeding the duodenum, right? If you just know what the words mean, it takes you to the right place most of the time. Our anterior intestinal artery and posterior intestinal artery. Intestine. This is a valvular intestine, right? So the anterior intestinal artery, anterior means towards the what?
Front.
Towards the front or towards the head. So here's towards the head. There's the anterior intestinal artery. And then back here in the back, here's towards the tail. This is the posterior intestinal artery. Gastrosplenic artery. This artery right here. Gastrosplenic. Goes to the backside of the spleen into the stomach. I lost my place. All right, caudal artery and vein, we already talked about those in the tail. If you're looking at the tail, you see the two holes on the bottom. There's a hole in, well, you can see it better here on this side. Remember, if I close the tail, this is the ventral side, this is the dorsal side. So the top hole is the caudal artery, the bottom hole is the caudal vein. All right, hepatic portal vein, dude, that's the easiest one to find ever. Hepatic tells you liver. You see that big yellow vein coming out of the liver.
Mm-hmm.
Hepatic portal vein. Gastric vein. Oh, there's the stomach. You see the yellow veins on the stomach, gastric vein. Anterior and posterior intestinal vein. That's the same thing as the arteries. Anterior tells you towards the front. So if I'm holding this like this is towards the front. That big yellow vein that's on the front side. Anterior intestinal vein. If I flip it over, you can see how this one starts about midline and runs back. This is the posterior intestinal vein.
We already talked about that one.
Huh?
We already talked about that one.
We did the arteries.
Oh.
Yeah.
Yes.
Did the arteries. All right, posterior cardinal veins. Those are these, they kind of blew up in this one, but on either side of the dorsal aorta up toward the anterior side, you can see these blue veins on either side. Those are the posterior cardinal veins. And lateral abdominal vein. So if I pull everything away and I look at this, remember if I'm in the middle, three-dimensionally, if I'm in the middle of this shark and I move all the way to the outside, that's laterally, right? So this is the lateral side of that cavity, and that big blue vein right there, that's the lateral abdominal vein.
Gotcha.
That's it.
Only 25
Any
minutes.
questions? All right, ready, set, go.